I just feel like Bjvim is a bunch of wonderful people who just give us, they give and give, and we're just so blessed to have them because they're just a wonderful part of our lives.
I started working here when this clinic started about, 10 or 12 years ago. And it's a joy to do that. I enjoy working with people, meeting people, and seeing lives transformed. Our pay is just working here and working with people. And the staff are fun to work with. They're having a good time. And so it really makes it a lot easier than the competition in private practice. My focus in medical care is to empower the patient. I give them a copy of their record, and when they use that and follow those directions, most of the problems will become under control. They're involved. If they don't have the data, they really can't cooperate because they don't know. None of us remember very well.
I came here from West Virginia and I'd worked. I'm a retired nurse, and I saw the Bjvim sign on their old place, and I said to my husband, you know, that'll be something to do while we're here. And I started 3 months after we moved here. So yeah, I've been here ever since. It's terrific. I mean, we have 1,300 patients, and we see them probably, some of them every 3 months, some every 6 months, some every 2 weeks. Just depends on what their situation is. And they get their meds, they get terrific care. I mean, you go to a local doctor and you don't get 1/3 of the care that they get here. So it's a terrific place.
We might have patients come in that have started to have their limbs amputated from diabetes that has progressed to a certain point, and other things that are so easy for us to treat with medication, like having high blood pressure. It does so much damage to the bodies, and $1 spent here in this clinic, it just saves so much more in preventing these continual emergency room visits. Because just because a person doesn't have medical insurance doesn't mean that they don't get sick. I had cancer, and once I finished up treatment, I wanted to give back. And it's very fulfilling to work with the patients here. You know, the need is very large, and most of them are so appreciative. Bjvim is really excellent. Sorry, I can't do this without crying.
They've helped me try to get my diabetes under control. Unfortunately, I had to have an amputation, and they helped me out to get my prosthetic. I have steady foot care now with Dr. Hufford to make sure we don't run into issues with my one that I have left. And my main doctor with my diabetes, Dr. Cross, is fantastic. And it's thorough as thorough could be. I appreciate everything they do. The biggest thing is, if I would have realized this sooner, I would have 2 legs instead of just one. The healthcare and medications and all aren't affordable, and without places like this, a lot of people would be in a whole lot worse shape than what they are now.
Unfortunately, we don't have insurance. We moved down here from up north, and with him and his disabilities and me needing to try to be around to help him, we're not able to get insurance, and just being so blessed with people who are willing to give of themselves and make it possible for us to have the health care we need is just so important to us, and we just can't say enough about how wonderful they are. Bjvim is my place full of angels.
I believe everybody has absolutely a right to good health care, and I'll tell you what, I think the health care at Volunteers in Medicine is every bit as good as any health care anybody's getting. It's very detail-oriented, the physicians are wonderful, and there is great attention to people's individual needs.
the reasons that people volunteer for this sort of a thing is that they feel like they have to give something back to the system. But another reason is that the medical care is in this area and this time and place is not as good as it could be, and there's a lot of people that fall through the cracks. And I like to think that we're providing some care to that group of people, and also it gives you a good feeling that you're actually helping out, not just sitting and idling and playing golf and going to parties and so forth. And I think it's a very good thing to keep you occupied in retirement. And in addition to that, you tend to keep up with medical developments and keep reading your medical journals and try to provide up-to-date care to your patients rather than something you remembered from 10 years ago or longer.
It was estimated that the free clinics in Hilton Head and Bluffton saved the hospitals somewhere between $12 and $15 million a year in uncompensated care. So if a patient comes here and gets seen and avoids going to the emergency room to utilize their time and personnel for which they receive no reimbursement, we provide the community a great service.
And that's actually, I think, something that's so impressive about this group of patients. They want help. I spent my whole life trying to convince people they need help, and here I don't have to do that at all. I tell them they have an issue, and they are more than willing to try to address it and change lifestyle if necessary.
I mean, it's been really good, obviously doing like the primary care and the family medicine part, but I've also gotten to see like GYN and cardiology and like just the whole like range of care that they offer here. It's not just like, you know, managing high blood pressure, managing diabetes and all that stuff, although that's important, but just getting to see how they take care of the whole patient. I mean, I think it will change the way that I treat patients going forward, you know, not just treating, you know, what are they here for today, but like consider, you know, what are their other factors in their life? What are their stressors? What is their environment like? How is that going to contribute to their overall health as a person, and not just what they're here for?
It's just amazing the number of patients that fall in the category where they're not eligible for Medicaid, but they can't afford to get dental care, and they go for months, sometimes years, with dental problems, with infections or pain. They just really appreciate what we do for them.
To me, dental is my happy place. I enjoy working with the patients, and when you have a toothache, you're always in so much discomfort. It's just so nice to have a place that people can come and we can help them and make them have a pretty smile and take them out of pain. I really enjoy seeing patients leave here with a smile, because they don't always come here with a smile.
Well, right after my husband passed away in 2010, I was just at loose ends, nothing to do, and, you know, feeling sorry for myself. And so a friend of mine said, you know, they're opening up this new clinic. Why don't you go and volunteer? Which I came, and that's how it all started. If I don't get to come in, I really miss it, because we had like 6 days off with that storm a few months ago, and I was miserable at home because I couldn't come in and do my work and help patients. They're so very nice. I was here last Tuesday evening, and we had about 6 patients that came in, and there wasn't a single one of them that wasn't appreciative of what we were helping them with.
I did have high expectations coming in because I knew a lot about Bjvim from my friends, and I think those expectations, quite frankly, have been exceeded. When I look at the breadth of services that are offered to our clients in the Low Country, it's much more than I was even aware of. At the same time, I didn't fully appreciate the number of patients that were served in the Low Country. When I look at especially women, you know, women with families, single parent homes, what have you. So the fact that it's a much broader patient base, I think, was more than I expected. Kind of makes my heart warm. I would love to see more people volunteer. I didn't go down this path because I knew I didn't have any medical background, and I felt like it was too overwhelming for me. I would just, you know, say to anybody, regardless of what your background has been, as long as you're willing and interested and committed to giving back to the community, this is a very fulfilling way to do it.
I love it. It's so rewarding. You get to meet so many nice people. The patients are so appreciative of the services that we provide. I've made so many friends with many of the volunteers here. It's just a wonderful organization.
The doctors here seem to be better than a lot of the private doctors. I've been to private individual doctors before, and it's kind of like in and out. Definitely a different kind of care. It's more of a personal care. You feel more comfortable. They try to help you with your problem and work you through your problems.
We certainly see a lot of need here. We are increasing our patient population every day, and when you see the people that come in, they are very glad to have this opportunity to be able to see a doctor and have the medications and things like that that they would otherwise not be able to afford. It certainly makes a huge difference in their lives, and it certainly makes me feel a lot better to be able to help them out.
As the community health worker, and basically I speak with clients that come in, or it could be any other patient that comes in that are in need. So I give them resources, I educate them. If they need help with doing an application, I help them with that. I help them enroll in Buena Vista. During intake Mondays, I give them a health assessment if they need food resources, if they need financial assistance, or if they need legal aid. I help them, I get those resources to them, and I stay in contact with them.
As you can see, the Bluffton Jasper Volunteers in Medicine is made up of an amazing group of volunteers. One of the things about volunteers in medicine in general is that the majority of our staff are volunteers, and then our paid staff supplements. What we would do without our volunteers, I can't imagine. It takes 67 volunteers each week to operate both clinics. If we were to pay this staff, our payroll would be over $700,000 a year. Without the dedication and love and knowledge and support of our volunteers, we wouldn't be able to care for all of our patients in our community. Please join me in thanking these volunteers, and if you'd like to volunteer, we'd love to have you.